High blood pressure rarely arrives with an alarm. You can feel completely normal while deep inside your body, excessive force strikes the walls of your arteries with every heartbeat. At first, nothing appears to be wrong, but if this pressure remains elevated day after day, the damage can slowly reach two of your most important organs, your heart and your brain. So what is actually happening inside your body? Every time your heart contracts, it pushes blood into your arteries. The top number in a blood pressure reading measures this force during the contraction. The bottom number measures the pressure remaining while the heart relaxes between beats. Your arteries are built to expand and recoil as each wave of blood passes through them. But when the pressure repeatedly becomes too high, their delicate inner lining experiences abnormal mechanical stress. Move closer, and the damage begins at a microscopic level. The smooth inner surface can gradually become less healthy. The artery wall may thicken, stiffen, and lose some of its natural flexibility. This creates more resistance against the moving blood, and that resistance can push the pressure even higher. It becomes a dangerous cycle. High pressure damages the arteries. Damaged, stiffened arteries increase resistance, and increased resistance forces the heart to generate even more pressure. Over time, damaged artery walls can also become more vulnerable to the development of fatty plaque. As plaque grows, the passageway available for blood becomes narrower, making it harder for oxygen-rich blood to reach important tissues. Now, look at the heart. To move blood through this high-pressure system, the heart's main pumping chamber, the left ventricle, must contract with greater force. Like any muscle working against heavy resistance, its wall can gradually become thicker. At first, this may appear to help the heart generate more power, but the thickened muscle becomes stiffer, requires more oxygen, and may not relax or fill normally. Eventually, the heart can struggle to pump enough blood for the body's needs. Meanwhile, the coronary arteries supplying the heart muscle are facing the same pressure and arterial damage. If plaque narrows one of these arteries, the heart may receive less oxygen. If a plaque ruptures and a clot blocks the vessel, part of the heart muscle can begin to die. That is a heart attack. But the pressure wave does not stop at the heart. It travels upward into the arteries supplying your brain. The brain depends on a continuous delivery of oxygen and glucose. Some of its blood vessels are extremely small, making them particularly vulnerable to long-term pressure damage. If a clot blocks one of these vessels, the brain tissue beyond the blockage loses its oxygen supply. Within minutes, brain cells can begin dying. This is an ischemic stroke. High pressure can also weaken a vulnerable blood vessel. If that vessel ruptures, blood escapes into or around the brain, compressing and damaging nearby tissue. This is a hemorrhagic stroke. Even without one major stroke, years of damage to tiny brain vessels can cause small areas of reduced blood flow. Over time, this may contribute to problems with memory, concentration, and thinking, and the damage may continue elsewhere. The kidneys contain delicate networks of tiny blood vessels that filter your blood. Persistent high pressure can damage these filters, while declining kidney function can make blood pressure control even more difficult. Tiny vessels inside the eyes can also become narrowed, damaged, or leaky, potentially affecting vision. This is why high blood pressure is often called a silent threat. Most people cannot feel the pressure damaging their arteries. Headaches, dizziness, or facial flushing are not reliable ways to know whether it is high. The only dependable way to detect it is to measure it correctly. One unusual reading does not automatically mean you have hypertension. Blood pressure changes throughout the day. An accurate diagnosis normally requires properly taken repeated measurements and professional assessment, but consistently high readings should never be ignored. Healthy habits and prescribed medication can reduce pressure on the arteries, lower the workload on the heart, and protect the blood vessels supplying the brain. There is no instant cleanse or miracle drink that can repair years of damage overnight. Your blood pressure is more than two numbers on a screen. It is the force reaching your heart, your brain, and almost every living tissue inside you with every single beat. This is Curious Human, revealing what is really happening inside your body. Like, share, and subscribe for more visual journeys through the human body.